Good afternoon, everyone. Thanks for joining us. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health. So our goal today is to update you on everything that's going on with our Mississippi Medical Cannabis Program, which you'll hear us call it MMCP. And I also want to take the opportunity to clear up some inaccuracies and I think some misconceptions. So this is a great time for us to do that and also get the latest news. And then of course, we'll take your questions. So as you know, in June, we met all of our statutory guidelines, which was tough, and kudos again to the program area and our legal teams and everyone that made that possible. And since that time, we've been receiving applications from businesses, practitioners, work permits, patients. And so we'll give you the updated numbers and then clarify a couple things. Joining us today is our State Health Officer, Dr. Dan Edney, also Ms. Kris Adcock, our Director of the MMCP program, and Mr. Jim Craig, our Senior Deputy and Director of Health Protection, who will help us understand any regulatory issues that may come up. So Dr. Edney, I know you are extremely proud of this program.
I am, Liz. I tell you that it's been a yeoman's task to get to where we are. As you mentioned, the 120 days that we have from statute to be up and running, have our rules and regs in place, and our infrastructure in place so that we could begin issuing licenses. And Liz, I definitely want to give a lot of credit to Dr. Thomas Dobbs, who led us through those 120 days and having the wisdom to hire Kris Adcock, that we would be able to recruit into the cannabis leadership. I can't say enough wonderful things about Kris and her team getting us to the point where we are now. It's really been all hands on deck. By the time I took over August 1st, we were already well into the licensing period, and I've been very pleased at the fairly rapid progress of being able to get licenses issued at every level at the provisional state where these programs where they can develop. But to get all the pieces in place has been an amazing job, and I am quite proud of our team, and especially Kris with her leadership. It is important for everybody to understand, though, this is a brand new program that no state agency has had to have anything to do with or have any experience with. And I want to give great compliments to the Department of Revenue, who've been great partners with us all the way through. It's been a great example of interagency cooperation where we've been able to help them, and they've been a great help to us, which I think has expedited getting us to where we are. But now we're in the maturation phase of the program. There lessons we're having to learn. We're trying to learn from the other states as much as we can. But Liz, I want to remind everybody, Louisiana and Alabama took significantly more time in the preparation phase than 120 days. So it's kind of been like building the jet as it's already flying. But we've gotten the job done in true health department fashion, and I'm quite pleased with that. Some key tenets of the program from my perspective as state health officer. My only concern with regulating this new industry is that from the agency standpoint, that we ensure the safety of the public and that we reduce any opportunity of diversion that we possibly can. And so for us, opportunities for diversion are public safety issues and have to be treated quite seriously. And that's what we care about, protecting the public as we do and all the things that we regulate. I am committed to transparency. There's a learning curve for all of us for sure, but we're transparent, I think, in all of our operations and all the entities where we have regulatory authority. I think we've been very transparent through the water crisis, and we will be transparent as we are moving forward with the cannabis program. There have been a lot of challenges, but I've been very pleased that Kris and her team and the agency in general have been able to step up and meet those challenges. And I will say, Jim Craig has provided a great deal of leadership and expertise in terms of getting our regulatory capacity up to speed where it is. Kris has had a small team, but they've gotten it done. And they, from day one, they've been working to get this program up and going, but also watching out for the public. And I'll let Kris talk about some of those issues in just a bit. But make no mistake, the agency has been regulating this industry from day one and will continue to do so as we go forward. But I am grateful that the program is maturing in terms of staff and experience and interagency cooperation.
Thank you, Dr. Edney. And also we should add that I think, and I might be wrong, I think 120 days for a turnaround is one of the fastest in the country. Have you heard anything about that? I've heard it was a pretty tight.
I know of no other state that's done it in less time than we have.
And I think
again, that's us and revenue. Revenue had, they were having to have that same heavy lift.
Okay, thank you. Kris Jones, can you start with giving us an update? We usually get them at the end of the month. Can you give us an update on the numbers and kind of speak slow because I know people are going to be writing those down?
Sure, I'm happy to, Liz. Just to give an update on where we are today, because the numbers change daily as we see interest grow in the program. But where we are today, we have 47 cultivators who are provisionally licensed, and that includes both our micro cultivators, which are smaller businesses, and all the way up to our larger businesses that are cultivating. We have 8 processors currently. We have 3 disposal entities. That's the waste disposal portion of the program. We have 2 testing facilities, and that's very important to note because testing is really where we see bottlenecks in other states. So for several weeks, we had 1 provisionally certified, provisionally licensed testing facility that was going through test validation process. And so now we have had a second testing facility provisionally approved for that process. So we really hope that that eliminates a bottleneck. We have 4 transportation entities. We have 138 dispensaries that have been licensed by the Department of Revenue. We have 117 practitioners who are currently registered with the program and seeing patients, trying to get those practitioner certifications done. We have 491 work permits that have been issued. That means we have 491 people who are now eligible for employment in the industry, and that's no small feat as we move into development. And then we have 406 patients who have been approved for the program currently. And we are seeing increases every day in the number of practitioners who are interested in the program. And we're also seeing increases every day in the number of patients who are interested in the program. So while we license businesses that range from cultivators to testing facilities, I really want to highlight some points around cultivation. That's where we've seen a lot of information in the media lately. And we know that this is an extremely competitive business. This is a new market in our state. And like we have done as a state agency, we've learned, we've developed as we move forward. Our businesses are really in the same position. They're doing the same thing. They're learning as they go along. They have looked at regulations. They are asking about regulations. We are providing that technical assistance while we really promote compliance during this provisional period. One thing that's important to note is while we are in a provisional period, we are conducting unannounced pop-up inspections or compliance visits, but different people call them different things. And we're also receiving complaints from the public that we respond to. So I do need to note that every pop-up visit that we have had thus far has been an opportunity for education. Nothing has gone without a blemish. People do have questions, they do have compliance issues, and we work through those compliance issues, and those on-site visits really give us an opportunity to do that.
Kris, that provisional period is exactly what this is for. right? They have a provisional license. And when we do these inspections, it's our opportunity to educate them and show them where they're doing well and where they're not. And as you said, everyone so far has had issues.
Yes, that's correct, Liz. Everyone has had an issue that we've had to provide some technical assistance on. There are different levels of corrective actions that we've seen, but that's really the goal of the provisional period, is to promote compliance and help educate the businesses about what compliance looks like. And we see things all the way from issues with tagging plants or not tagging plants. And that can lead to opportunities for diversion. We see issues in that maybe we have to provide technical assistance on what a work permit process looks like, and an individual has to start that. So we have to work through those issues while we're in this provisional period so that we can move to a regular licensure period. During the provisional period, we also work with the businesses because we have many businesses that may be in different phases of construction. And so while they're constructing, then they will remain in a provisional licensure period until we can see that actual physical structure that will ultimately be where they either cultivate or process, depending upon the type of license that they have. One of the things that we need to note is there's a lot of opportunity right now for transporters and for waste disposal entities. The ones that we have provisionally licensed at this point are really those businesses that want to be vertically integrated. So there's opportunity for transporters and for waste disposal entities to really get into this space to do business so that the program can develop even further and that the medication can ultimately get to the dispensaries and then available to the patients. So I think as we move through these issues, we are ironing out issues every day as we go through this process. We are very careful to look at where we are in metric, which is our state seed to sale system. And that gives us an ability to even monitor and look at compliance remotely. Because we can see what those businesses are doing through that system. And that helps us gauge with data on when we have problems or issues that we may need to look further into on site. So Liz, those were some of the highlights that I had.
And Kris, how the provisional period is 4 months right now?
The provisional period is 4 months right now. That can be administratively extended because, like I said, we have different businesses in different phases.
Absolutely, yeah.
So that can be administratively extended.
Okay, thanks, Kris. You can take a breath now. Do you all have any questions? Because so far, Kris, why don't you go over the numbers once again while people send in? We have a couple of people that didn't catch all of them.
Sure, no problem. So we have 47 cultivators. We have 8 processors, 3 disposal entities, 2 testing facilities, 4 transportation entities, 138 dispensaries. Those have all been licensed. 117 practitioners, 491 work permits issued, and 406 patients approved for the program currently.
Thank you, Kris. Appreciate that. So Anthony Warren is asking, what kind of waste is produced and how does it have to be disposed of? Kris, I'm going to throw it to you, and if you need Jim Craig, or you just go ahead and do that.
Sure. So we do have waste disposal regulations that are very similar to other states. And what that allows them to do is that as they trim the plants, there is some waste that results from the plants. So they can then dispose of that waste so that it becomes unrecognizable and unusable. And they can do that through different methods, but probably the most common method is through composting.
Okay, and thank you. And Jeff, you have a question here, and I just want to make a point before I read it out loud, and that is that when we go during this provisional period and we look at these plants and educate, plans of correction are written. Is that not correct, Kris?
Yes, there are plans of correction that are written. There's also technical assistance that's provided on site to help them remedy issues.
Okay, so Jeff's question is, have any actions been taken with Mockingbird Cannabis, given Dr. Edney's comments to the board indicating that would be the case? They did receive a plan of corrections, did they not?
Yes, they did receive a plan of corrective action. They were working that plan and have been working that plan. I need to note that they have been very professional and very cooperative throughout this process. And we do have an order in place with them where they have some halt on operations right now. They've also had some impacts to their operations and that has resulted in some capital improvements that have had to be made at that facility, and that some of those improvements will be ongoing to satisfy that corrective action. And then they've also had to destroy a number of plants in their inventory.
Thank you for that. And I'm glad we got this next question because I really think there has been some confusion about the provisional licenses. So Taylor Vance is saying, can you please explain the process of provisional licenses? Because I don't remember that being part of the statute. How are provisional license issued and when does a permanent license get issued? Kris?
Sure, I'm happy to address that. And Jim may want to chime in on that too, because we do provisional licensure in a number of our regulatory programs here at the health department. But Taylor, you're correct. That was not originally in the statute. That was built in through the regulatory process. And in that process, a provisional license is given for 120 days, 4 months. And it gives that business entity the ability to go ahead and get their application in. If you've looked at the application process, there are probably upwards of 20 documents that have to be provided. Some of those range from proof of residency to security plans to site plans. So sometimes it takes them a little while to complete all of that information. And during the provisional licensure period is when they can submit standard operating procedures that we may be giving some technical assistance to help them refine those standard operating procedures so that they can ensure that they are compliant.
Thank you, Kris.
Sure.
Thank you so much. And Kris, did you talk about staffing and the progress we've made? I was kind of concentrating there, so I didn't know if you had mentioned all of that.
I think I probably failed to mention that, so thank you for reminding me, Liz.
Yeah, we made good progress there. I'm pleased, right?
Yes, we're making a lot of progress in that arena. I'm happy to say that by the end of November, we will have doubled our staff. But I do need to point out that even though we've had a small staff, it's really been all hands on deck to accomplish the mission. That is the only way that we were able to get regulations in place. And that's really what enables us to go out and do those on-site visits and do some of that administrative monitoring, even through our data analysis now.
Thank you. Let's see. We've got a question from Jeff Pender. Actually, it's about staffing. Given the staffing and other provisional issues Dr. Edney outlined to the Board of Health, how certain are you there has been no diversion of marijuana grown to date to the black market? Kris has a seat. Do you want to take that, or are you, Sandra?
Liz, I'll be happy to take that. We've had the same level of compliance going from the beginning of the program, from cultivation till now, that we will have 3 to 4 months from now. It's just been harder for Kris and her team to get it done. But I want everybody to understand what she said about the remote monitoring. That's an extremely important part of our regulatory operations, that Kris and her team are able to see what's going on with those plants and to actually look at inventory and tagging and what cultivators are doing with their plants remotely from their office. And they have picked up on issues. Now, how can I assure that there's been no diversion? If you remember what I said, we're doing the best to our ability as the statute will allow to reduce diversion as much as possible. We're not going to be able to get that to zero, but we're getting it as low as we can through our regulatory authority based on the statutory conditions that were given to us. I have full confidence that we're doing more than a reasonable job of protecting against diversion, and we will continue to do the very best of our ability. And as we, are bringing on more staff next month, that just makes the job easier and for Kris and them to do. But they're doing it now. They will continue to do it next month, and will continue to do it next year.
Thank you, Dr. Edney. Let's see, Kelly, I skipped you and I didn't mean to. Is the department able to meet the current turnaround time of 30 days for patient approval? And is there a way for them to check the status? Kris?
Yes, patients, once they establish an account with us through our online system, they're able to log in at any point and check that status. So the information is available at their fingertips, really. One of the things that we work through many times is that when a person, even when a business submits an application, there are things that may not be correct or that they may have overlooked because it can be a lengthy process, particularly for businesses. So if there are items that they are missing or items that are deficient, then we work with them to remedy that. During that process, we don't consider an application complete until all of the elements are there. And then that's really when that 30-day window starts.
Thank you, Kris. Ross is asking, what were Mockingbird's violations? That would be the plan of corrections, correct?
Yeah, Liz, I would really refer everybody to the consent order that we've agreed to that outlines everything that is needed. It's public information that's available through a public information request. And I would really refer everybody to the consent order.
Okay, I think Jeff, you already have it, but Ross, just send me an open records request and we will be glad to have legal approve that and get that to you. That way you can have it officially from the document, which thank you, Dr. Edney. Great suggestion. Let's see, Jeff, how many plants did Mockingbird have to destroy? They said they were growing about 20,000 at their greenhouse site. Do you want to take that, Kris?
I'm happy to take that. I don't know that I can give an exact number without having that right in front of me, so that may need to be requested. But there was upwards of $1 million worth of inventory that had to be destroyed. So that ranges right at about 5,000 plants.
I'm sorry, Kris. Thank you. Let's see. Okay, now I don't even know if we'll have this, but we can perhaps check into this for you, Jimmy. Kingfish is asking, how many have received corrective action plans? How many COPs have been issued? Is that something you have at your fingertips or is something we need to look up?
I don't have that at my fingertips, but I'm happy to make that information available.
Okay, so if my team back there would note that, and Ross's open records request, thank you. Let's see. Wicker Perlis, hello, from the Clarion Ledger. What is the current wait time for a business application to be approved for both a provisional and a permanent license? Kris?
Sure. So everyone is receiving provisional license right now. So I'll speak to that. And it's really dependent upon the applicant and the thoroughness and completeness of their application. So once we have a complete application, we do have 30 days to review and turn around a decision.
Okay, thank you. I do not see any more questions at this time. So what I typically do is ask each of you, and Jim, we haven't chatted with you. Do you have anything to add? You are the king of regulations and know everything.
Yeah, just real quickly, Liz, thank you for that. But I do know that as Dr. Edney mentioned at the top, this is a very important role for us here in the health department in the regulatory space to ensure patient safety and to minimize or eliminate potential diversion. And you heard conversation about the monitoring process that we have through the seed to sale system. Just kind of know how important that is. We wish we had that type of system in all of our regulatory programs, but this is an over and above component to help keep that safety piece in place, as well as to help minimize diversion in the state.
Are they difficult regulations to understand?
Yeah, if
Maybe
you're
interpreted different? I mean,
I think if it's like any regulation set we have out there, and we regulate quite a few things in public health when you think about it. These are some fairly technical regulations, especially in the laboratory space. But most people that are in this industry are pretty comfortable with them. We've gotten some good comments back. We've made some adjustments to regulations over time already. And just like any regulations that we have out there, we anticipate that there'll be changes as we move forward.
Okay, now, thank you, Jim. Jeff is asking, let's see, let me see here. I'm sorry. I saw something from Jeff about greenhouse. Oh, yeah, here it is. Okay, so Jeff is using the term greenhouse. Will growing in greenhouses be allowed? Define, please. Kris, you have an excellent definition of this. And so we go by the definition, so shoot.
Yeah, so as we've said many, many times, neither the statute nor the regulations specify a structure by name, whether it's greenhouse or anything else. What the regulations and the statute both require is that cultivation take place indoor, enclosed, and secure locations. So that was the mandate by statute. We took that mandate even further and operationalized that to include enclosed roof structures, permanent walls, solid foundations. So we give a description of the physical environment that cultivation can occur in, although we do not specify by name.
Thanks, Kris. Let's see, I don't think we touched on this. Russ Adams is asking, when will dispensaries start selling products? I know we have talked here when we anticipate that product would be on the shelf. Did we say January, Kris?
So we anticipate that it will be towards the end of the year, first part of next year. And that's really because the testing facilities need time to get stood up completely. They have to validate their measures. They have to make sure that they can test everything as it's required. So anything that's grown or processed still has to be tested in its final format before it goes to retail at the dispensary.
Thanks,
Liz,
Kris.
I would remind everybody that really that's been our projection from the beginning, and we've not wavered from it. Everything is still looking towards probably January for product to be in the dispensaries. But right now, I think the agency has everything in place that we can do to facilitate that. We'll continue working with everybody to try to get these few bottlenecks worked out. And I've been real pleased with Kris and her team providing technical assistance, and Dr. Ware at the Public Health Lab, working with the testing sites, trying to help them be able to reach the level where they can move forward with their testing.
Thank you, Dr. Edney. You bring up a very good point. There are factors outside of our control that will also be indicative of when the product will be on the shelf, but we are in good position here with what we need to do. Thank you, Dr. Edney. Let's see, Jeff Pender is asking, what is the time frame looking like for patients being able to receive medication? Kris?
So the patients will receive medication through the dispensaries. So like we said, it will be towards the end of the year, first part of next year, before product is safely tested and available.
Okay, thank you. And I will ask either Dr. Edney or Jim Craig to answer this next one. Taylor Vance is asking, is MSDH making any recommendations to the legislature about changes in the medical cannabis law?
Liz, when I testified to the Drug Policy Committee for the House, I was asked that question, and there certainly are things that we can tweak going forward, but I favor let's give the program a year at all levels, from seed to sale, and let's watch how it's working. Let's let it continue to mature, and let's make thoughtful changes and not reactionary changes. I think we give it some time. A lot of problems will work themselves out. We're very flexible and open to regulatory changes as long as it does not increase the risk of diversion or impact public safety.
Thank you, Dr. Edney. Anthony, you can address that question with my team at the office. Let's see. The next question, will there be a logistical backup for testing when the first of 2 labs opens? Do we know a time frame for the opening of the labs? Kris, why don't you talk a little bit about that, okay?
Sure. So the labs, like we said, are provisionally licensed right now. That gives them the opportunity to get their test validation methods in place to make sure they can test accurately. They are in the process of doing that. One is a little bit further than the other just because of the timing of their applications and their startup. So we are working with them to review that validation as quickly as we can and turn it around back to them so that we can remove any bottlenecks.
But it is a time-consuming process, isn't it?
Yes, standing up a lab is a very time-consuming process, whether it's for this or any other type of clinical testing that might occur. And since it is so important that testing be accurate and be available, we really do want the lab to spend as much time as they need to validate their measures and make sure that they can test the product to put a safe product out.
Thanks, Kris. Okay, so Natalie from WLOX, the number of patients approved seems low given the overwhelming approval by voters. Is this due to a low number of practitioners? Why don't we take this one at a time? Why don't you take that one first, Kris? And you can, I mean, talk about what you think that's all about.
Right. So I think part of it is we've worked actually with the Patients Alliance and several of the other associations associated with the industry. And part of that initial message was that while we are in the startup period, patients really did not need to be in an overwhelming hurry to get their application in, because there is by statute a 60-day window. So when they get certified by a practitioner, they have to apply within that 60-day window. So really, we think that we do have a number of patients and interested potential patients who are waiting until we're a little bit closer to the finish line and that there is product available on those retail shelves at the dispensary.
And those patients have to have an established relationship with the practitioner, correct?
That's absolutely correct, Liz.
Okay, let's see. Okay, now part two from Natalie wants to know about mass card events, which have we gotten a lot of complaints about that, Kris? I mean, the only way you're going to get a card is online, doing it through the health department. So have you heard a lot of complaints?
So there have been some issues where people have misunderstood the process, and they thought that once they initially saw a practitioner that they would receive a card at that point.
Mm-hmm.
That's only the beginning of the process. Once that person sees a practitioner, makes their wishes known, the practitioner makes that recommendation and provides that practitioner certification, then they have to complete the application process themselves. So people have misunderstood that and thought that once they saw the practitioner, that was the end of the process. So we actually have a great handout available on our website that really walks them through step by step the patient enrollment process.
And thanks. And Alyssa is asking about a list of practitioners, which we do. It is voluntary to be on that list. And Kris, it's at the Mississippi Alliance. What's it?
It's the Mississippi Cannabis Patients Alliance website. Practitioners who are registered with us and make the decision to make their information available to the public do so through that Patients Alliance website.
I guess a patient could just ask the physician, are you certified to do this too?
Absolutely.
Okay. All right, let's see. We have the Vicksburg Daily News. Are there any regulations that are more relaxed at this point to help the program get its footing with anticipation of becoming more strict? I'm going to let any one of you take that.
I'll start with that. We've not relaxed any regulations, but as Kris and her team are identifying deficiencies, we are trying to provide technical assistance, as Kris said, to help get them into compliance and help them understand how we're regulating the program. Unless we see evidence of potential diversion or issues of public safety, then we have to step in as we have done recently. But during the provisional period, as Kris has said, we're wanting to work with those we're regulating, as we do in other areas that we regulate, to provide technical assistance, get people to compliance. Let's get this program mature and moving forward together.
And we actually do that in all our program areas at the health department. We educate, we guide. We want people to be in business, but we just need them to do it the right way. Let's see. Super Talk, are 2 testing facilities going to be enough to keep up? You did allude to elimination of backlogs. Kris, do you want to start?
Sure. So we do have 2 testing facilities that are provisionally licensed. We know at least one of them estimates that they can test, can conduct about 500 tests a month. We do need more testing facilities. The licensure is unlimited, so we do not have a cap like some other states do. So if there are interested parties out there, I would really encourage them to look at those regulations to think about what that might look like as a business model for them also.
All right, and what is the current staffing of the program and what's anticipated? By the end of November, Jeff, we will have 9 employees in the office, and we are also going to be executing contracts for compliance. Kris, am I correct on that?
Yes, that's an option that we have looked at because we think it will make us very flexible. It will give us an ability to scale based on the needs at the time. So that is an option we're looking at, Liz.
Okay, thank you.
Uh-huh.
Let's see, Sabrina Robinson from the Natchez. Okay, I got you from the Natchez Democrat. Okay, hi Sabrina. Are there pending provisional licenses not listed on the MSDH site? Currently, there is only one listed for Adams County called Highest Care LLC, and there is a group called Coles Creek Cannabis LLC supposedly planning a cannabis conference in Natchez in 2 weeks. Have you received an application from this business, and is this a legitimate dispensary? So let's take the first one. Are there pending provisional licenses not listed on the MSDH site?
So we update weekly the licenses that are issued. That is on our establishment registry that is included on the website. And we also link you to the registry that the Department of Revenue maintains for dispensaries. So that information is there. Any pending applications, I really can't speak to because the statute itself has a confidentiality provision to protect those entities.
Thanks, Kris. And then the second part about Adams County, the Highest Care LLC, and a group called Coles Creek Cannabis LLC, supposedly planning a cannabis conference in Natchez in a few weeks. And so can we speak to if we have received a license, an application? I don't know that we can't speak legally. We cannot speak. I'm getting the note there. We cannot speak. I think it's just once the application is approved. Am I correct?
That's right. Once an application is approved and a license is issued, that information is available on our website.
Thank you. And I guess at this time, because I don't see any more questions, but I'll take them as they come up, but we'll do the round robin. Jim, Craig, any revelations, any thoughts as we have gone through this process?
No, it's so good to hear from the program of all the accomplishments that they've been able to do in such a short time. And we have quite a few regulatory programs just in the health protection area. There's 67 different programs, many of those being regulatory. As you heard today, some of the approaches of provisional licensure and working with regulated communities to comply with statutory requirements, as well as those requirements that are put in regulation by the State Board of Health, is key. I applaud the work the team has done to make sure that patient safety is on the front burner every day that they're out there doing their work. So thank y'all.
Thank you, Jim. Kris, any thoughts as we come to a close?
I just want to say, I think it's a very exciting time as we move forward with this industry. It's a real critical time because we really are promoting compliance, and it's really about preventing diversion. It's about ensuring product safety and ultimately patient safety. And so we don't want to jeopardize those things, but it's an exciting time in the industry, and it's an exciting time in the state as we move forward.
And before I go to Dr. Edney, Jimmy from Jackson Jambalaya is asking, what are the most common barriers to patients and providers? I guess he's talking about the application process. Are there, do you know, Kris? Jimmy, can you tell me a little bit more about what you're asking? Just send me an email because I'm not sure quite what you're asking. Okay.
Liz, let me share this in that regard. I was wanting to make sure that the application process was not cumbersome and was not an impediment. So without Kris's knowledge, I went through and became a certified practitioner.
Wow.
And, even for this gray-haired old doctor, I was able to get through it fairly well. And, it did not take very long. I got my CME at a conference already and went through the application process, didn't even get charged for it. And it was fairly easy for me. I'm not hearing complaints along those lines. I am, as I'm speaking around the state and I'm talking to practitioners about the cannabis program, there are a lot of them that are still sitting on the fence and not sure what they want to do. They want to make sure it's not going to impact their overall practice. And as I have a thoughtful conversation with them, most of them see the value of a thoughtful decision between a physician or provider and their patient about another tool in the toolbox to try to alleviate pain and suffering or other symptoms. And as I talk with them, they're more reassured. And Kris, I think every time we speak somewhere and we talk to providers, whether they're APRNs, physicians, or optometrists, we get several jump into the program. So I think it's going to take some time. I think there are several folks that we need in the program who are just kind of standing by, watching and waiting to see what's going to develop. I can tell you that they want it to be a medical program, Liz, for physicians and providers who have not already signed up. For the rest to sign up, they're looking to make sure that this is a medical program and that they're going to be able to use it as they would the rest of their practice with other controlled substances. So that's why the agency, our rules and regulations are for a medical program, not a recreational program. And we've done all that we can within the statute's limitations to make it a medical program. And now we're partnering with the provider community to recruit more. And I think we're having some success. It's going to take a little time. I think we have enough practitioners now to take care at least of the patients that are currently certified, but we'll be recruiting more as we move forward.
Thank you. And Kingfish was referring to the application process, and I think we already talked, Kris, about the patient process and where there might be some misconceptions or holdups. We have a question from Super Talk. Let's see, making medical marijuana legal in our state represents a huge shift for law enforcement. What are you hearing from them? So I prefer that you talk to law enforcement, unless anyone here disagrees with me. I think it's important that they talk to you directly from their agency perspective. And Dr. Edney, do you have any closing comments that you would like to make?
Sure. This is an important program that we've been working to stand up on behalf of the folks in Mississippi who did overwhelmingly ask for it. And I think we've done it to the best of our ability. Yes, lessons learned will continue to improve as we go forward. I think that's what you would expect of us. But I also like to remind folks, Liz, that our plate with public health has been pretty full. We've just in my short tenure of 3 months, I mean, just look at all that the agencies had to deal with the last 3 months. So I thank God that Kris and her team have been there faithfully pushing ahead with maturing the cannabis program. We have hospitals closing in the Delta, so we've got issues of public health ahead of us. This is one of the issues that we deal with. We care about it. We're going to do the best job we can for it, but we have other things to pay attention to as well.
Yeah, if you go look at our website, you can see all the various activities we're involved in. And right now, I told my husband this is the first time I've been activated for four different situations for emergency preparedness. So we do have a lot going on, but we're all doing the best we can. And Dr. Edney, you've done a great job too, as Dr. Dobbs left, taking over aiding in the MMCP program. So we appreciate that. I got another question. Oh no. Okay, that's all right. Sorry. Okay, so listen, I appreciate all of you on behalf of Mr. Jim Craig, Ms. Kris Adcock, and our State Health Officer, Dr. Edney. Thank you and have a great day.
Thank you, everybody.
Thank you.